Why is it important to tell your rheumatologist what symptoms you're experiencing?
When it's inflammation in the spine, I can't see it. I can't even feel it on exam because it's sort of deep deep in the back. So really, what we use to determine if our treatments are working or not and if the disease is well controlled is a patient's description of their symptoms. So patients have to be comfortable and have to be honest with themselves and with their doctor about the pain that they're experiencing, and not just the pain they have today, but since the last visit.
What prevents patients from playing a role in the management of their ankylosing spondylitis?
A key element to that is good communication. So they have to be comfortable in communicating with their physician and in being able to talk about their symptoms and talk about their pain. They have to have done their own monitoring of their symptoms, because if I haven't seen them for 4 months, and if they didn't keep track of how they've been doing over time, and so there's a certain element of self-monitoring where, whether it's from journaling or taking notes or having a way, whatever system works for you, that you are able to remember and tell me how you've done over that period of time.
What is the main goal for ankylosing spondylitis treatment?
So the goal is around inflammation. So it's inflammation that's causing the pain in the spine, the pain in the joints, or that's causing the other features of ankylosing spondylitis that are outside of the spine. So our goal is to completely eradicate inflammation as much as we can. We're trying to prevent the damage to the spine that causes the fusion of the spine. So when there's ongoing inflammation, it can cause the spine to fuse, and then patients don't have as much mobility in their spine, so we want to prevent that. We want to prevent inflammation in the joints to prevent damage in the joints. And also there's the extra-articular features. So if the goal of treatment is to have no episodes of inflammation in the eyes or uveitis, and no inflammation outside of the joints.
What do patients need to understand what clinical remission is in ankylosing spondylitis?
The concept of clinical remission is that the inflammation is well controlled and there's no manifestation of that inflammation. So it would mean ideally no pain, but if we're not able to achieve no pain, it would be little pain that doesn't interfere with activities, no inflammation in the joints, no extra-articular features that are active, so no inflammation in the eyes, no flare-ups in the eyes, no flare-ups in other parts of the body, and also no further progression. And we also look at the marker of inflammation in the blood. So we don't want the marker of inflammation in the blood to be high, because then there can be effects of inflammation in the body.
What does an ankylosing spondylitis treatment plan look like? And what sort of things can help patients and physicians achieve those objectives?
So I think what's really crucial about achieving an effective treatment plan is that it has to be our treatment plan. So patients have to be involved and be part of the decision, and the plan has to be made together. Now, what is part of a treatment plan? I mean, central to our treatment plan is the medications, because they are what will make a difference in terms of preventing the progression of the disease and controlling the disease and bringing down the pain to an acceptable level. But it's not only about medications. There's a lot of other aspects in a person's life that can be managed to help achieve those goals as well. And then there's all the other parts of self-care. There's, a healthy diet, getting the right amount of sleep and rest, managing your energy, taking care of your emotional well-being, because we know that patients with ankylosing spondylitis are at greater risk of depression. There's also anxiety about what does the future hold and dealing with pain, and we know that depression, pain, anxiety, they all feed within one another. When you have more pain, it gives rise to more of those symptoms and vice versa.